Discover KDH Collective's Leaning into Therapy podcast, an enlightening exploration of therapeutic approaches and evidence-based protocols. Join us as we delve into the vast landscape of therapeutic interventions, guided by the belief that collective intelligence surpasses individual expertise. Led by Katie Holmes, a licensed professional counselor with 16 years in private practice. This series offers valuable insights, expertise, and training from a team of skilled therapists. Prepare to immerse yourself in the world of therapy, created exclusively for therapists by therapists.
Hello, and welcome to another episode of Leaning into Therapy. I am Whitney Storey, and with me again today is Monet David. Welcome, Monet.
Hello. Thank you for having me.
Of course. So we are going to do a brief little chat. Let's talk about this brand new class that we are bringing to KDH Collective. So the class is Neurodivergent Sex. Two of the most fun things to talk about. I was thinking earlier today about the fact that this class has been at least a year in the works. And I feel like every conversation we have about it, I kind of like reconceptualize and get like excited all over again about the content. You said something earlier that got me feeling like really rooted, really grounded, and really excited about these last little updates we're going to be making to the class. And that is the fact that we, as licensed professional counselors, are leading this course on sex related to neurodivergence. Yet we are not sex therapists.
We are not sex therapists.
Could you talk a little bit about why that might actually be not just a good thing, but I think an exciting thing about this particular class?
So for me, like the way that I conceptualize it, and I mean, for most clinicians, they understand like we go to grad school, we do practicum, we do internship, then we do years of being provisionally licensed with a supervisor, right? Well, when you become a registered sex therapist, you're kind of doing that process all over again for the sake of saying that you are a registered sex therapist, right? So there's this heavy distinction in training as well as theory and knowledge. And so it's almost this like, yes, there's this relief. When you show up as a participant to this class, we don't expect you to be a sex therapist, and we're not teaching sex therapy. But to not talk about sex at all in session feels like a big miss. Like it's going to come up.
Yes.
And so you as the clinician deserve to be informed about sex. I think it's that distinction that we make at KDH where it's like being informed versus being competent, right? We want you to be sex informed. We want you to know what to look for, potential presenting issues that may come up with your neurodivergent clients in the context of sex, and to know your scope as well when it's appropriate to refer out. So like being able to hold a conversation, to apply therapy 101 skills, to have knowledge about sensory issues, to have knowledge about interoceptive, proprioceptive concerns is all we feel within scope of being a licensed professional counselor, being a licensed social worker, and does not extend beyond what we think is completely reasonable to talk about in session. So
yes.
ethics, all of it. Does that resonate with you? Does that feel like your same conceptualization?
Totally resonates with me. And I think one of the things that I think is helpful for people to know, I think it's helpful for us to like, as we're conceptualizing this topic overall, like we are not sex therapists. And so we're not going to be training as if we were, like training our participants as if we were sex therapists. However, talking about sex in therapy is important. It's normal. And it's one of the areas that I know you and I had a really similar experience in grad school where it was like, we were lucky enough to have a class. Most of the time there's like not a class. So I think this is really important and really fun as well to be able to talk about sex, to be able to learn about sex in a way that is within the scope for a licensed professional counselor, a licensed clinical social worker, to be able to talk about sex in session. We don't have to write off clients who come to us with sex-related concerns just because we're not sex therapists. So I think there's like, it's so nice to be able to like fill in that gap and then be able to decipher like, oh, okay, now we're like a little bit more outside, and to know what to do at that point as well.
It feels so similar to like, if you're working with somebody who has experienced trauma, if you're working with somebody who maybe needs medication intervention. And what I see the parallels as is we need to be able to talk about it and talk about it confidently and ethically. And we need to be able to assess with clients, does this need further attention that is outside of our office? So like, you're right, you know, in the sense of like, we don't prescribe medication, but we can really coach and help our clients show up to their first medication management appointment very empowered and giving them language that they maybe didn't have before then. And that's how I'm seeing this course is, if there is an issue with sex, if there is an issue with, like physiology and they need to go speak to a professional about it, we want to be like, let's talk about how it feels to go talk to somebody about this. Kind of scary, kind of vulnerable. Let's talk about word choice so that we are making sure that we're communicating as effectively as possible. Let's role play together. How do you want to talk about this? And that's assuming again that like it's something that needs to be referred out. Right. Simply just being able to talk about it. Sometimes they just want to say the thing. I cannot tell you how many clients have been like, and it's not even that it's necessarily sexual, but I could see where it would in the sphere of it. Sensory stuff, neurodivergent clients. I don't like wearing underwear or bras, Monet. And I'm like, good for you. And it was just therapeutic for them to be able to say it in a session. They felt like, oh, is this weird? Is this different? I don't want to come off like I'm trying to seduce somebody. I just hate the way they feel. And I'm like, that's so normal. That's so normal. And
that's such a good example. I was literally going to ask you, like, you don't, I wouldn't say you like advertise yourself as a specifically like sex therapist-ish. You definitely advertise yourself as like competent. How frequently do clients bring up topics related to sex in your caseload?
It's not often, but it is this green flag for clients. And the way that I use that language, I did pursue a certification to become a sex educator that I ended up ultimately not finishing with. And so I'm really candid about that. Not a sex educator, but I have 170 hours in sex education training, right? So there is this knowledge there. And that's kind of how I phrase it. Like, I'm not uncomfortable talking about it. And for them, that's a big buy-in. They may not come to therapy for that reason, but if it happens to come up, they'll be like, hey, you know, you mentioned on your profile, Psychology Today, that you have this training and you're cool talking about it. Can we talk about this thing? And honestly, it's just like 5 minutes of a session. And like just being able to speak it out loud was like the really therapeutically valuable thing. So it looks like in the context of what I'm doing, a lot of psychoeducation, a lot of normalizing, destigmatizing, pathologizing, and then offering them, you know, we're very fortunate that in our area, we are besties with the one registered sex therapist. So it's like, hey, if you want to go deeper into this, let's go talk to my friend who's a registered sex therapist, and they'd be happy to work with you. And most of the time it doesn't really necessitate a referral, but I like opening that door for them if they feel like they want to go deeper into it.
I love that. Yeah, it makes total sense. I have to say, as someone who doesn't even have like the sex educator hours under my belt, like it's not really like a big part of what I advertise myself as in terms of being a counselor. It comes up a lot in my sessions. And I think if I had asked like, you know, a few years ago me to guess, I definitely would not have guessed that it would be this frequent. And as I'm thinking through like the years, it's not just with my couples, it definitely does come up, especially with my mixed neurotype couples. But it comes up really frequently with my individual clients too. So it feels really important. It feels very like special to be able to have, you know, the independent research, all of the intentional learning that you and I have both done in order to be able to feel competent to talk about this stuff. So
I think about the neurodivergence experience, and not for everybody, but for a lot, it's a very lonely experience. There's this struggle with connecting, and so for a lot of folks, this is the first sort of relationship where they get to show up as themselves and they get to feel comfortable. I think we do a really good job of being intentional about how we coexist with them in our space. And so it's like, of course, sex is going to come up. Like there's this really safe environment with which we can talk about anything. And I think we both practice the non-judgmental, unconditional, positive regard. And so it feels like an honor. And so subsequently, it feels to me like I need to know my stuff in order to be able to carry that. And not that I can be everything for one client,
of
but
course,
to like start the conversation, to not shy away from it, to not avoid it, to acknowledge it, feels really important. And so I think, of course, we're teaching this class now, right? Like we want to share that with other people, that sometimes the therapeutic relationship is the most functional relationship in somebody's life. And so subsequently, it does become this vessel for all the worries and concerns. And all the more reason to just know a little bit about everything, I suppose. And I think we do a good job with that.
I think so too. And this also is why I think this class has been like such an important class for us to be talking about and planning and working on and researching, because I think the clients that we see, you know, we're not teaching a class on sex for therapists. We're teaching a class on the intersectionality of neurodivergence and sex. And I think that's really unique, and I think that's really important. In addition to like what you've noticed about your clients, potentially this is the healthiest relationship they've had. A lot of my clients being autistic and ADHD, they've been struggling for so long and getting so many messages about how like their experience is not true or not valid, getting feedback about how they are in the world. And then I think there's this other additional layer of being neurodivergent. Relationships are so difficult. And so I think there's like this unique mix of clients that show up for me. And I would guess your clients are very similar in where like for some of my clients, we're talking about what it would even be like to be in a sexual relationship, and kind of like grieving the lost time of not having a sexual relationship. And then for kind of the other batch is talking about how neurodiversity and sexual diversity intersect, and how, you know, the individual experience of sex can sometimes conflict with the partnered experience of sex, and like destigmatizing a lot of the natural shame, I think, that comes up with that.
I also think about just unique relationship structures and like the appeal of that. So I'm thinking like sugar baby, sugar daddy sort of arrangements. Of course, somebody with a neurotype, like who would like things to be spelled out, would love that.
Yeah.
Things are spelled out so much, right? And so as a clinician, not quickly assuming it's pathological, like it can very much function for them. I think about, polyamory, and like perhaps a couple has determined, or a relationship has determined, we can't offer everything to each other. And so it just makes sense for us to have other partners so that all of our needs get met. And it's not rife necessarily with like the turmoil that you could potentially see in a different neurotype. And so
So maybe it's not like
understanding.
sister wives.
Right, right.
Oh,
Or, the thing that I think we kind of cringe at the most is the infantilization of
yes.
neurodivergent people, that they couldn't possibly have sexual desires or libido or want to be partnered. For as much as I like kind of don't engage, I do think Love on the Spectrum has kind of put that at the forefront, like to be human is to be sexual. So like it's silly to think that having a different neurotype, having a disability would eliminate that part of a person. It's such a human thing. And so if that's something that like a bias that a clinician may possess, like come to this class, come learn about it, it's all good stuff.
Yeah. Yeah. And like, the combination of your expertise in terms of the world of like the sex education plus the neurodivergence. And I'm thinking too about like all like the huge umbrella of sexuality that exists, like what it is to be autistic in the world and wondering about asexuality, and not seeing yourself reflected in media, not having maybe friends who experience sexuality in that way. Yeah, it's such an interesting combo of topics that make me really excited to teach the class.
I hope that our enthusiasm, which I think the feedback has been that it definitely comes through when we're teaching, of just like, this is really cool. We really care about it. We want you to care about it. I feel like we're very personable when we teach too. So it's not this like, we're the experts, don't participate, just listen. No, we want to know what you've seen in session. We want to know what worries you have, where you feel like you're falling short. Because we know like that universality experience, somebody else in that Zoom call is going to feel the same way and is going to be really grateful that you said it at all. And I think we're also really mindful of neurodiversity in that, it's this conversation. We're not necessarily employing role playing. We're not necessarily involving small group discussions, but we're just kind of like having this dialogue the entire time. And I think we're good at doing that and making it accessible to people.
That's such an important thing. Being a big old nerd as I am, and I know you are, attending lots of continuing education, a neurodiversity affirming continuing
Yeah.
education experience for other clinicians is just another one of those things that I think is very unique about the way that we do things at KDH. And yeah, no role plays.
No role playing.
What a win for us and
Never
our
make me role play.
participants.
It's so valuable. Like I don't want to throw the baby out with the bathwater,
Yes.
but it's a lot. It's a lot. And we really want it to be this relaxed, show up as yourself. No pressure to be this capital P professional mental health person, but as a student who's curious, and hopefully feels that infectious enthusiasm from us.
I love it. I think hopefully people have picked up on how excited we are and what big nerds we are. And yeah, I'm looking forward to sharing this teaching experience with you. So
it's gonna be great.
Yeah. Well, thanks so much for joining me to chat about this today.
You're welcome.
And I will see you later. Hope to see the rest of y'all later as well. Bye.
Join us on Friday, July 17th for our continuing education webinar, Neurodivergent Sex. This course is approved for 3 CE hours for counselors and social workers. The KDH Collective is an approved ACE provider with the Association of Social Work Boards ACE program, and all of our courses are approved by NBCC. Register and find out now at our website,